And so now I will transition to introduce Kate Dibble. She is a researcher at the Dana-Farber Cancer Institute. She joined us over the last couple of years. And she will talk about some of the educational programs and clinical program and resources that we have at the Dana-Farber Cancer Institute. So thank you again.
Okay, let's see if this cooperates with me. Hi, I'm Dr. Kate Dibble. Thank you for the introduction, Larissa. And I'm here today. I'm very excited to share this. We created an evidence-based resource for Hodgkin's lymphoma survivors that's public and it's available now. So we originally know that Hodgkin survivors are at increased risk for late and long-term effects due to their cancer or their treatment, or both. We saw this and we wanted to do something about it. So a couple of years ago, pre-COVID, we created this intervention to meet the range of needs reported by Hodgkin survivors. And we found that survivors reiterated their need for more information beyond physical well-being for both themselves and their support, whether that be friends, families, caregivers, as well as physicians. So survivors reported that they felt empowered with this information presented in the intervention, and it allowed them to promote their own health and well-being during survivorship. So using the results from this intervention, we partnered with the Dana-Farber Adult Survivorship Program and the Dana-Farber Lymphoma Program to release this resource to the public. We created this resource for survivors specifically of Hodgkin lymphoma, caregivers, their loved ones, and their clinicians. Oh, it's being mean. Oh no, okay. And it has a modular format. So as you can see, we highlight topics from cancer risks all the way to family and relationships, and we're still adding to it currently. And actually, we want your feedback, but I'll get into that later. So while we have many continuing goals, we strive to improve the knowledge and awareness of long-term and late effects, as well as increase the utilization of survivorship services to improve health outcomes, not just immediately after treatment, but long-term into survivorship. So I'm just going to show you a little tidbits, examples from the online resource that is currently available, like I said before. The entire website has been created and vetted by experts at Dana-Farber from both the two programs that I mentioned earlier, lymphoma program and the adult survivorship program, as well as others. And it is continually being updated based on new research and feedback from advocates, survivors, and clinicians themselves. So there are educational videos throughout the website that feature Dana-Farber experts, among others, as well as resources for survivors, caregivers, loved ones, and their clinicians. So one of our modules is the risk for secondary cancer, and that discusses survivor health after treatment and what screening to receive and when. So it outlines breast, lung, thyroid, gastrointestinal, and skin health in detail, supplemented by expert advice on how to promote the health in these different realms and what to look for. So caring for your heart is another module, is important for those who received radiation or chemotherapy. And in this module, we discuss the modifiable risk factors as well as screening for heart issues throughout survivorship, outlining exactly when these are recommended and in what type. So you could screenshot this, take a picture of it, or I put the website in there as well. It's available to everyone, and there's a quiz at the end. If you see something that you want in the website or something that we missed, please let us know. We will be more than willing to do that. And like I said, it's continually updated, and I'm available for questions after this talk if you would like. Thank you very much.